Hello, Danny Blyth here, looking at Akabane tests and how to balance up left and right side in acupuncture. Remember, this is for acupuncture students and practitioners only. Please pause and read this. This system was devised or popularised by Akabane Test, a Japanese acupuncturist. He essentially used the same method of diagnosis but treated the imbalance using the back shoe points, which is different to what I'll describe here. And Herbert Schmidt studied with Akabane Test, and he was the person who taught most of the Europeans that now use this system. We used the nail points on the channels, and we repeatedly passed an Akabane stick, which is essentially a Japanese style incense stick without the wood inside it. We pass it diagonally over the Jing points, the nail points of each channel, and we count the number of passes until the patient feels the sensation as hot. We record that number and then check left and right. It's good to stabilise their digit, either their toe or finger, with your non-dominant hand while you're doing this. A positive test is one where there's a more than 25% discrepancy between the two sides over 2 to 3 repeated tests, allowing 3 minutes between a test. Because there isn't a Jing point on the kidney, we use the medial nail point of the middle toe for the kidney. And a higher number of passes means that the channel chi is relatively weak. So on the hand, we use the Jing point of lung, large intestine, pericardium, triple burner, heart and small intestine. On the foot, we use Jing points of spleen, liver, stomach, gallbladder. On the medial little toe, kidney and bladder. Warming the Jing points can help to actually correct the imbalance. You may find that just doing the treatment and retesting corrects the balance. If it doesn't, tonify the deficient side, the highest number, using the low connecting point. If that doesn't do it with retest, we'll use 3 to 5 moxocones on the low connecting point. If that doesn't do it, then we'll tonify the UN source point and finally moxa the UN source point. Getting close to the nail point and being careful not to touch and burn and stabilising the digit, we pass over the Jing point, counting the number of passes, starting on the spleen channel. Once the patient feels the heat, they'll say hot, and then we move on, stabilising the digit to the liver channel, diagonally towards the centre of the nail, passing over the Jing point, being careful not to burn, knocking off the ash if it looks like it may get loose. Carrying on to the stomach channel, making sure that the person doesn't move their toe and inadvertently burn themselves, and making sure that we're not getting too close. The gallbladder channel on the 4th toe, and we're notating the number of passes until it feels warm. Remember, the kidney is on the medial side of the little toe rather than using the Jing point on the sole of the foot. And then finally the bladder. And we're going to notate all of these numbers down, and we'll use them to compare them to the other side. On the hand, we'll do the same thing. Lung channel on the thumb. As soon as they feel warm, stabilising the digit with our non-dominant hand, passing the incense stick diagonally over the Jing point, nail point, large intestine channel. And we carry on working through pericardium using the radial nail point of the middle finger rather than the tip of the middle finger. And then moving on to triple burner on the 4th finger. Again, make sure that you don't burn, make sure you don't get too close, but you need to get close enough that they feel it, and you need to be consistent so that the passes are equal on the two sides. It takes a little while to calibrate this, but soon enough you get the hang of it. Make sure that you knock the ash off when it gets long, because it can get warm. Small intestine, heart on the little finger. And then we've worked through each of our 12 channels. Once we've done the heart on the medial side of the little finger and small intestine on the lateral side of the little finger, And once we've worked through all 12 of the channels, we can do the other side and compare the sides. We leave 3 minutes between each test, and we do 2 to 3 tests to make sure that our figures are consistent. Each of the channels, we look for a discrepancy 25% or more. So in this case, there's a discrepancy in the lung, the small intestine and the bladder. On my second test, the lung had already corrected itself, but there was still a discrepancy between the small intestine and the bladder. The third time I was lazy, I didn't do the other channels, but there was still a discrepancy between the two sides of the small intestine and bladder. So to correct these, I tonified small intestine 7 on the left hand side, the more deficient side, I had the higher number of passes, and I tonified bladder 58, the lower connecting point on the bladder, the deficient side, the left hand side, with the highest number of passes. Thanks for listening.